Good afternoon, sir, distinguished guests, respected faculty members, and honorable delegates. We now move to one of the most insightful segments of our international online panel based on the theme Global Scenario of Integrative Medicine. This session brings together visionaries who have shaped and advanced the global movement towards the integration of traditional and modern healing systems. It is an honor to welcome such eminent experts from across the world. To chair this distinguished session, may I warmly invite Dr. Pawan Kumar Godatwar sir, chairperson for today's session. Now we have the privilege of hosting an exceptional panel of international leaders. With us today, we have Dr. Antonio Morandi, Scientific Director of ICAM 2016, Chairman and Director of Ayurvedic Point, Milan, Italy, and President of Italian Scientific Society for Ayurvedic Medicine. His pioneering work has built bridges between Ayurveda and modern science in Europe. We are delighted to have you with us, sir, today. Now I'd request our co-chairperson, Dr. Jitendra Mishra, sir, to kindly invite sir and
Namaskar, sir.
Namaskar.
It is my honor to have you all here in this international conference. Now, I am going to speak something about you, sir. Dr. Antonio Morandi is a medical director, doctor, a specialist in neurology and respected figure in the field of Ayurveda. He is the chairman of Ayurvedic Point in Italy, a neurologist and a qualified Vaidya Ayurveda practitioner who has advised the World Health Organization on traditional medicine. He is known for his advocacy for global recognition of Ayurveda and for his efforts to integrate it with the other medical system. He is a medical doctor with specialization in neurology and a degree in Ayurveda from the Ayurveda Academy in Pune, India. Sir is the chairman and the director of Ayurvedic Point, an organization dedicated to promoting Ayurvedic medicine. He is also the president of Italian Scientific Society for Ayurvedic Medicine. Sir has served as an advisor to the WHO on several working groups concerning Ayurveda. He advocates for global acceptance and integration of traditional medicines with modern medical system. Sir teaches an elective course on Ayurveda at the State University of Milan. He is a member of the Commission on Non-Conventional Medicines for the Board of Medical Doctors in the province of Milan. And Sir has authored numerous scientific publications. He was also awarded the Jandu Award for the research in Ayurveda in 2017. He was granted the honorary title for the Ayurveda Acharya in 2003. Now, so I welcome you, sir, to address the gathering.
Thank you very much for your introduction. Thank you for inviting me. Thank you, Chairman, for giving me this opportunity to share with you my perspective, my ideas. And since I am a neurologist, I would like to share with you my view about how we can join and interface the Ayurvedic view on neurodegenerative diseases and Ayurvedic view. This is important because we are facing a diffusion of Ayurveda worldwide, but there is still some kind of skepticism, there is some kind of fear from modern medicine. And as a modern doctor, actually, I don't see the reason of this fear. I see Ayurveda that it is the source of the highest knowledge to which a medical doctor or a scientists can reach. So all my life, all my recent, my last 30 years have been devoted for finding a way to have these two epistemology, to this, system of thinking to in some way meet. Not to integrate, because they cannot be merged one with the other since they are very different epistemology. But we can interface. We can interface and we can, have them communicate in order to find an higher and common paradigm that can satisfy both for the benefit of mankind. Because it is something absolutely true that modern medicine is worldwide diffused and that Ayurveda, besides India, is having a diffusion, but in some way has always to face this contact with modern science. And since we have to work for the benefit of the patient, we have to find the best of the two worlds, the two epistemology for the benefit of the patient. So if I may share the screen now, I want to start my presentation. Here it is. Okay. Can you see it? Can you see it? Is it clear? So,
Yes, sir. Yes, we can see, sir.
first of all, okay, very good. First of all, of course, I want to bring homage to all of our teachers. We don't say my teacher, with all of our teachers, because without them, we would not be here, none of us. So it is very important for us. In the West, we are losing this this idea of the teachers, and this has been for me another great gift of India, that to find again the importance of the teacher, and to be to look at the reality only with the advice of the teacher. We are only channel that we bring on the knowledge of our teachers. So the epistemologies of Ayurveda and modern medicine are very different, as I was saying. The conceptual framework in which nature and science are interpreted depends on many factors, But nature is one. So there is a lot of human diversity, a lot of human viewpoints, but nature is one. And so we have to find a collaboration of multiple perspectives. You in India, you are advanced in this kind of exercise, since with the darshana you have this collaboration with these different viewpoints in order to find a common view of such a complex thing like reality itself. Since in the West we are used only to take in account only one perspective, so you understand that this is a difficult task for us, for Westerners. But we, of course, through the Indian wisdom and knowledge, we are trying to find a different way of looking at our reality. And Ayurveda is the tool that we use for this. So we have to find a new transcultural framework that has to be identified and built, where there is a cooperation between two systems of knowledge, and where it's important to identify similarities between the system, not differences. If you look at difference, we will not go anywhere. We have to find similarities. And we are all human. This is the first similarity. So we are all living beings. This is another similarity, And we have the same dignity. This is another similarity. But these are basic things that nowadays it looks like that have been lost in many situations. So we have to identify similarities that enable this effective interfacing, not merging, but interfacing. Because we have to find a synergy, a synergistic therapeutic strategy for both the system. So we have to find a way to connect the ability, the inclusive ability of Ayurveda and the ability of having this systemic observation with the analytical and technological ability of modern medicine. I want to make, I want to stress one point, by the way. It is clear for me, and of course, this is everything is based on this assumption, that one of the main differences between modern medicine and Ayurveda is the fact that Ayurveda is inclusive and the modern medicine is exclusive. This means that I can explain modern medicine with Ayurveda, but modern medicine cannot explain Ayurveda. Ayurveda is based to the vision of darshana on what we can call physics. Modern medicine is based on chemistry. You can explain chemistry with physics, but not physics with chemistry. This does not mean that chemistry is wrong, or physics is better than chemistry. But there are two different levels, and we have to consider this reality as two different levels that they have to communicate, because these two different levels, they describe, different perspective of reality. But Ayurveda is inclusive, so Ayurveda is able to tell to modern medicine what is the structure of modern medicine and what modern medicine is doing and is looking for. This is something that is very difficult and risky sometimes, because we don't want to touch the sensitivity of my modern colleagues. But in fact, what I'm trying to do is just to find the way to put the things together. And so, in fact, for doing this, we, identified this system, this collaborative medicine and science system, which I presented, is almost 10 years ago, and we have published many papers on the topic, in order to find a way to make this two system a dialogue. The collaborative medicine and science has three main steps. The first one is the reformulation of Ayurveda epistemology. Reformulation of Ayurveda epistemology in order to be understood from modern medicine. Look, this is not the explanation of Ayurveda through modern medicine tools or ideas or framework. It's right the opposite. Is to explain to modern medicine how Ayurveda works with modern medicine terms, but not through the modern medicine logic, because the logic of Ayurveda cannot be bended to be fit in modern medicine logic, because it does not fit. It does not fit. It cannot fit. The second one is the modeling. So we have to find mathematical and other kind of visual modeling in order to overcome the communication gap that they may have, the cultural gap, and then the localization of Ayurveda, because Ayurveda, nature is one, but is expressed in different way in all the world, because we have a different, ecosystem in Italy. You have a different ecosystem in India, and so we have to be aware of the fact that we are, different same living beings, the same nature, but expressing this a different way. And since Ayurveda is based on the expression of life, of course, Ayurveda has to be localized, not globalized. Localized. It's like when you have a Microsoft, Office. You have Microsoft Office in Italy. You have the engine and the keyboard. You have the Microsoft Office in China. You have to have the same engine but a different keyboard. So this is the difference that we have to do. The engine has to be the same, but the expression is different. So now we have to look at with attention to the COMS reformulation methodology, because this is the key of what I will tell you later about neurological disorders. We have to start from modern observation, clinical, neuropathological, biochemical, and we have to that's an error, sorry. We have to break them into observable properties. Then these properties can be abstract as Guruvadi Guna, that identify the dominant qualities expressed by this function. For example, neuroinflammation can be expressed by Tikshna, Ushna, and Ruksha. No? So when we have done this, we may map guna to function, because guna as you know very well, indicate dosha dynamics, dhatu status, srotas health, agni variation, oja stability. And these guna are the link between the form and the function. You know, modern medicine look at the form. It doesn't care about the function. Ayurveda care about the function that give rise to the form. So guna are the link between form and function, perception and intervention. Once we have mapped the guna, we can infer doshic disturbances, agni dysregulation, and rotas level, rebuilding an Ayurvedic model based on the modern observation. So we explain modern observation through Ayurvedic logic. And we have a coherent interpretation of a modern identified disease with guna logic. And this allow us to identify hidden dynamics and progression. And it is a reverse flow, it's a reverse engineering that leads to a new systemic interpretation, absolutely non-obvious therapeutic pathways. We can generate novel predictive and therapeutic insights based on this logic. And we will see this later. In practice, COMS means that we have to use traditional concept to predict where to look for systemic connection. We have to interpret modern findings through traditional frameworks to reveal additional layers of meaning which are not clear in modern observation. Then we have to develop a research hypothesis based on traditional understanding of disease process. And these research hypotheses can be validated using modern scientific methods, but they are traditional hypotheses, not modern hypotheses on Ayurveda. They are traditional hypotheses on modern medicine that can be validated through modern methods. So we validate modern medicine through Ayurveda. And this is the revolution. Because this is the point. This is the big error that has been done so far for me. I'm a modern medical doctor. And you cannot explain Ayurveda with modern medicine. Absolutely. Because the logic of Ayurveda is beyond the comprehension of modern medicine. But the goal, of course, is not to replace modern understanding, but to enrich it with traditional wisdom and while maintaining epistemological integrity of both systems. We don't want to have a fight. We don't want to have, some kind of competition. We want to find the best way to work together. Example of Alzheimer's disease. This is a comparison between a healthy brain and an advanced Alzheimer's brain. If we make that, work of looking and then abstracting to guna, the healthy brain has snigdha, slakshana, mridu, and guru properties. I mean, you can see it. And this brings you to an idea that the brain, from a gross morphological point of view, is kapha. I don't know if you have ever seen a brain. I mean, I've seen so many because when I was working in the United States, I was following patients, waiting that they were dying, taking the brain, cutting the brain, making, all the... So, as a neuropathologist, the brain is a very kappa object, no? A very kappa object. When it is an Alzheimer, you have a complete different feature because it becomes like a shrunk walnut. Is ruksha, is kara, is katina, is laku, and it presents the vata features from a gross point of view. So we can suppose that from a gross anatomical, examination, the Alzheimer's disease at the brain level is a vata problem. But the funny thing for modern medicine is that, and this is the beautiful of the inclusiveness of Ayurveda, is that you find the same vata problem that you see in the brain at the clinical level, because vata features are present in the clinical symptomatology of Alzheimer's patients. We have memory loss, which is prana, with all the 5 vayu. Problems with language, udana, difficulty in performing familiar tasks, vyana, misplacing regular items of utility, vyana, poor judgment, prana, problems with abstracting thinking, prana, and so on. These reflect, this clinical behavior, reflect the structural compactness and coherence, the loss of compactness and coherence. So, this is the vision of Ayurveda, the inclusive vision of Ayurveda, that see the same principle at different levels, which is completely new for modern medicine. And, this view can lead us to, for example, see how the unhealthy neuron work. These are healthy neurons, and if you look at them, we can find that these neurons, they have some, Laku, Ruksha, and Kara, which are in some way Vata related, but in their functional level, not only morphological, they have Tikshna, Sukshma, and Vishada, guna, which is Pitta. So unhealthy neurons has a characterized by Vata Pitta balance, and this balance bring you the normal functionment of the brain. This is an Alzheimer's brain. In the Alzheimer's brain, you see that there is a disruption of the neurite network. All the synapses are gone because of two main neuropathological features. One is the neurofibrillary tangles, which are mass of neurofilaments in the body of the neuron, and the amyloid plaques. Now, the fact is that the amyloid plaques precede the neurofibrillary tangle because the neurofibrillary tangle are the expression of the neuronal death. And if you look at these neuropathological images, you can see that the neurofibrillary tangles and the disruption of the neurites is very much Vata resembling Vata, Vata guna, impression, while the amyloid plaques are very ama, very pichila. And we will see also that why. So there is in an Alzheimer brain, there is a further increase in the Laku, Ruksha, and Kara, which we can see from a gross morphological point of view, but we see a decrease in Sukshma, Tikshna, and Vishada, which bring us to Pichila, Manda, and Stula, which is the characteristic also of the clinical behavior of an Alzheimer patient, which is not able to work in the environment, to be able to be dynamic in the environment. And this reminds also the vision that we have of a neuropathological level, because we have Pichila, Manda, and Stula, which are the features of the Alzheimer, the amyloid plaques. We can see the consistency of this vision also at the ultramicroscopic level. This is an electron microscopy picture in which we can see that the healthy area and the tangles that are formation, we can start to see a disruption of the neurofilaments. But what happens, and this is the real thing that make the difference in the vision of Alzheimer's disease. The problem of the amyloid plaques is the fact that there is this amyloid protein which increase in the extracellular level. Amyloid protein is a transmembrane protein. The amyloid precursor protein is just a transmembrane protein, and this transmembrane protein is cleaved at a certain level, and for the rebuilding of the protein, normal turnover of protein. When you have a problem in the membrane, and you have a decrease of the thickness of the membrane, the amyloid protein is cleaved, is cut at another level, because part of the transmembrane part of the amyloid is exposed. And this transmembrane, since is inside the lipid membrane, is hydrophobic. And since it is cut at another level, this hydrophobic part is let free in the interneuronal space, and is stick together, forming the amyloid plaques. But the fact is that the decrease of the membrane is the effect of the increase of Vata, is a decrease of Snigdha. If when I was a scientist 40 years ago, working in the United States on Alzheimer's disease, I would have known more about Ayurveda, or would have known something about Ayurveda. I mean, I would have done this discovery much before. And instead of, now it's understood, but much time later, but it's not still seen in the importance, in the general importance of the Alzheimer's disease, because the problem of the membrane degeneration is not only in the brain. In the brain is the most visible, but you find everywhere in the body, in the organism of an Alzheimer patient, because as Ayurveda says, a problem like a neurological problem like Alzheimer is not a body, a brain problem. It's a whole body problem. And in fact, we have problem at the level of all the membrane, at the membrane of the fibroblasts, of the gut lining. We have a problem everywhere. And this justify the Vata Vyadi, logic, where in the Vata Vyadi you have not only problems which modern medicine refer to nervous system, but all other system, because it's a Vata problem. And you know this very well. I don't want to teach you anything because you know already all these things. But what I want to tell you is the fact that these things can be very important to show to modern medicine how Ayurveda can prevent and predict what for modern medicine is absolutely obscure. So the logical sequence, according to is that there is a problem that becomes poor quality, Ruksha and Laku. There is a loss of snigdha. Yes, do you have other 5 minutes? Yeah.
5 minutes.
Yeah, 5 minutes. I had also Alzheimer, Parkinson, but I will skip it. So we have the increase of snigdha and Vata in very subtle pathway. We have this cognitive disconnection, and we have all the problems that we have seen. So Meda does not remain local. It's a whole body. So the disease begins not in the neuron, but in qualitative failure of insulation and meaning of integration. These are some of the latest view of research, and this is a work that we have done in 2012, in which we confirm this because we have seen that the increase of Vata of the patients it goes along with a loss in the membrane. In the membrane structure of the brain cells of the patient. I will go fast. So what I want to reach to this? What are the novel therapeutic insights? We can address Meda Agni before amyloid formation. We can prevent Ruksha with early Sneha Rasa plus Agni Dipana. And we can use Guna balancing therapies to prevent the terrain for neurodegeneration. These are all the tools that Ayurveda use, Sneha, Medya Rasayana, Vatabasti, Nasya, Ojas rebuilding rituals, all dedicated to the rebuilding of the terrain, not specific to the brain, what modern medicine done, because the goal is not just to boost memory, but to restore the terrain of connectivity and coherence. But the most important thing is that this new novel therapeutic insight can be used also to use modern medicine in a different way. Because, for example, in Alzheimer's, we have the acetylcholinesterase inhibitors. From an Ayurvedic point of view, these increase Sukshma and Tikshna, but they lack Snigdha and Stira. So there is an improved information flow, but there is not content integration of anchoring. So these act like medial stimulant without Oja support. And this may worsen Chala, Ruksha, if not paired with Neha and Oja's care, which is what happened, which are the collateral effect of cholinesterase inhibitor. So we can pair acetylcholinesterase inhibitor with Rasayana and Sneha support to prevent Vata aggravation. Another thing we can do with NMDA receptor antagonists, which are used to block the excess glutamate toxicity, which happen in the problem of an Alzheimer brain, in the confusion that there is, neuropathological confusion that there is in Alzheimer brains. Because the NMDA receptor antagonists, they dampen Tichnaya and Chala, but they create Mandashita. And this can be good from one side, but bad from another side, because they can increase the dullness. They see like Pitta pacifying, with Pitta Vata pacifying drug, but there is the risk of Ojas suppression. And so also this we can pair with Agni Dipana herbs to maintain alertness and protection. So this is what I wanted to say. Now I have the example of Parkinson's disease, but there is no time, so I think that I will stop here. If there is any question, I will be happy to answer. Thank you very much. Or if there is time, I will keep on going.
One question from the delegate, sir.
Yes.
Thank you, sir. It was a wonderful opening for me. So, can you please explain the role of gut microbiome in Alzheimer's? That slide, it was not clear for me, actually.
The gut?
Gut microbiome.
The gut microbiome.
Yes,
The gut
sir.
microbiome, yes, is absolutely important because since since in Alzheimer's disease there is a general increase of Vata, the general increase of Vata and the reduction in Snigdha is present everywhere. Is present also in the gut lining. So there is also an alteration of the microbiome because there is an alteration of Agni. There is an alteration of Agni. There is an alteration in the digestion and the environment of the gut. Connected also to the loss of stability of the membrane of the gut. So this is the thing. This is the thing. So the beauty of the vision of Ayurveda, it can justify every observation that we can, every modern observation that we can see. Because, modern medicine has wonderful observation, but they are dispersive because they are not able to connect them together. It is like the game that you may find for the children, all the dots with the numbers. You have to connect the dots with the numbers, and then you find flowers, an elephant, whatever at the end. But in modern medicine, give you these dots, wonderful, round, beautiful, black. You can see all of them, but there are no numbers. Ayurveda put the numbers. This is the thing. This is wonderful because as a modern doctor, for me is the bonanza of science, Ayurveda. I can really understand medicine with Ayurveda. And this is something for me fantastic because I studied medicine because I wanted to find Ayurveda. And I have to thank India for this, for saving and preserving this incredible knowledge that changed my life so much. And I feel more Indian now than Italian, of course. As Professor Singh told me many years ago, I was absolutely shocked. They told me, oh, you are looking Italian, but you are Indian. You look Italian. You are more Indian than other Indians. Professor Singh, R.H. Singh. So this is but this is not because of me. It's because Ayurveda awakened in me this thing.
Thank you so much, sir, for such an intriguing session. We are really delighted to have you with us today. Now may I warmly invite Dr. Pawan Kumar Godatwar, sir, chairperson for today's session, for his valuable remarks.
Antonio, good to see you. And as usual, I suppose you are freezed. Can you hear me?
No. Can you repeat, please? Yes, okay. Hello, how are you?
Namaste. Good to see you.
Namaste.
Okay.
Good to see you, really. I would like to be there with you, but
We will see you physically. So, as usual, a very scintillating talk. And again, looking forward to your deeper insights on the clinical aspects of the Grita and all. I would like to read that more. So if you can see some material, That will be wonderful. Otherwise, I am sure that this talk has spiked interest and curiosity in everyone to move further. Thanks a lot for your insightful talk. I would have liked to hear Parkinson's also, but some other time
we can
maybe.
we can find another occasion. We can
Yeah,
find another occasion.
we
But
can.
but one but yes, maybe yes. There is one thing. One of the because we have many studies going on with this logic of collaborative medicine and science, but one we published recently on Journal of Ayurveda Integrative Medicine about how to read modern drugs with in an Ayurvedic way. And this is something that is amazing for us, for example, because sometimes we don't have only Indian pharmacopoeia, and we have patients that come to us with modern therapy. And in this way, we can connect and we can use the technology of modern medicine, in the Ayurvedic way. I think that this is some kind of a jump that we could do and we could teach to modern medicine.
I hope youngsters are sufficiently inspired by this, not just the correlation, not just the jugglery of words of gunas and doshas, but going that
Yeah.
one very crucial step further and testing them on
Yes.
multiple drugs. That is the wonderful thing coming from you. Thanks a lot, Antonia.
Thank you. Thank you very much.
Looking forward to meeting you soon. Somewhere.
Yes, it's a pleasure for me. It's a pleasure, really pleasure.
Bye.
Hello to everyone. Bye.
Thank you very much, sir, for accepting our invitation and coming on online and enlightening our delegates. We are very thankful to you. When you visit India, we welcome you. Thank you.
Thank you. Thank you. In a short while, I will be there. But not today, unfortunately. But I see Simone here. Hi, Simone. How
Hello,
are you?
Antonio. Hello.
Ciao,
Fine, and
Simone.
you? Your great speech. Thank you.
Thank you very much. Ciao.
Okay.
I welcome Dr. Simone Hunziker from Switzerland Ayurveda school. She has started Ayurveda school in Switzerland, and she is also the school students come to India to learn Ayurveda as internship basis, and she is a great scholar in both uh, streams of medicine. And I request our organizers to continue.
Good afternoon, ma'am. As sir introduced, Dr. Simone Hunziker, ma'am, is our next resource person. She is Secretary and OED Director of the Swiss Ayurvedic Medical Academy and founding president of the same. She has been instrumental in promoting Ayurveda in Switzerland and across Europe through her profound knowledge and visionary leadership. Now I invite Dr. Jitendra Mishra, sir, to kindly give a brief introduction about ma'am.
Namaskar, ma'am. Namaste, ma'am. Now, I'm going to introduce about the Dr. Simone Hunziker. She is a renowned expert in Ayurveda and integrative medicine. She is a medical doctor from Switzerland with extensive experience in Ayurveda, naturopathy, homeopathy, and psychotherapy. Ma'am is a medical doctor with specialization in Ayurveda and trained in naturopathy, homeopathy, and psychotherapy, and practicing in integrative medicine since 1996. Ma'am is expert for Ayurveda at the World Health Organization. She is a rapporteur for the development of global guidelines for Ayurveda. She is pioneer in integrating Ayurveda into Western healthcare system. Dr. Simone is also a secretary and OED director, Swiss Ayurvedic Medical Academy. She is a founding president in Indo-Swiss Ayurveda Foundation, and she is also an academic chair in Swiss Medical School. She is first foreigner to receive the Pandit Shiv Sharma Award for promoting Ayurveda and recognized by the Indian government for her contribution to the Ayurveda. Ma'am, Ma'am has also played a significant role in promoting Ayurveda worldwide and integrating it into mainstream healthcare system. Her work has been recognized globally and she continues to contribute to the field of Ayurveda through research, education and clinical practice. So I welcome you ma'am to address the gathering.
Thank you very much. It is an honor to be here. Can you hear me? Can you hear me? Can you see me?
Yes, ma'am.
Yes?
We can hear and
Okay, thank you. Fine. Okay. So thank you very much for that bright introduction. It sounds very big. I'm a simple person. I had the chance, like Antonio Morandi, to meet with India, to be welcomed, to be fostered somehow, to be introduced into this extraordinary medical system that is Ayurveda. And I feel like him the same need to contribute in return to India and to mankind. I mean, Ayurveda has here a huge, huge role to play, I believe, for the future generations when it comes to sustainable global health. And I mean every word I say. And we have all together a responsibility in this, a very big one. So Antonio Morandi, he gave us a brilliant analysis. I consider him being really, a precursor, a forerunner, pioneer in this field of, we called it integrative medicine now, new terminology is collaborative medicine, where he really translates that in his daily practice up to a research level, which is very important. But what we can see when we heard his speech is, he is in a position that most of all of us we are just not there yet, right? Collaborative medicine, he gives us a bright example of what it can be. But how can we get there? That is for me the question, very practically, because in the West, and even in India, I mean, we have modern medicine trained physicians who just have no idea about Ayurveda. And we have in India and now also in other places in the world, Ayurveda trained physicians with some understanding of allopathic medicine, but not to the extent that they simply can do the links and the analysis that Antonio just did, right? So I will take that topic of collaborative or integrative medicine from a totally other angle, not a clinical situation, but how can we get there all together from where we stand? How can we make, for me, integrative or collaborative medicine is the trampoline, is the one step that Ayurveda has now to take in order to give its contribution on a global level to contribute to sustainable global health. I have been kind of, how do you say, obsessed over the last 25 years by the idea that mankind needs a medical system that really caters to health issue. I mean, or to maintaining health, to understands health, right? And I just saw that right now it's not there. And mankind cannot continue like this. It's a very grave situation. It's very serious, right? I had actually come to a point of despair. I'm an MBBS trained doctor, but I saw the limits. And at a point in time, I just felt that the Lord had forgotten to create a medical system that would help mankind to maintain its health in future. And then I met with Ayurveda, and that was like something incredible because I saw, no, the Lord did not forget this medical system. It is there. And I mean, Chinese traditional medicine has been of the same dimension, but it has not, through history, it has not been preserved. Same Egyptian medicine, Iranian medicine, Mayan medicine. India has been able to preserve its medical system, and don't ask me how, because you have been amongst all the countries the one that has been occupied, colonized, everything. And you were able to maintain until today this knowledge system that is Ayurveda intact. So this is a responsibility. And how can we bring this to mankind? This is actually my vision, right? So, and that's what I'm saying. For this, we have to go through integrative and collaborative medicine. It's the only way. And one day, hopefully, we will be on a level of which now just Antonio gave us an example. And I will now just show a little bit the way, the path that would lead us there collectively, and the challenges that may lead there, right? So this is a speech on potential and risks of integrative or collaborative medicine when it comes to Ayurveda, as per my experience. And we just go quickly through the background of my experience. It has already been exposed partly, and why this integrative medicine beyond what I just said now, and the challenges of integrative medicine with Ayurveda, as well as some models of integrative medicine, practical, right? As it was mentioned earlier, I have been doing a lot of regulatory work. In Switzerland, we have institutionalized Ayurveda as a medical system, and that was a lot of regulatory work. And then the same at WHO. And so I look at it a little bit from that perspective. How can we bring Ayurveda as a medical system to become a global streamlined system of which mankind is dearly in need? That's the point. So my background, it was already told in 1996, I opened a clinic that from 98 onwards actually became really a center of integrative medicine, as I had been trained in various fields, as you had heard earlier. And in that center, of course, I brought in the allopathic practice, the modern medicine, and the fields in which I was trained. So I would have an approach a little bit like Antonio Morandi in my clinical practice. But in addition, in that center, I had brought in people from Chinese medicine, from osteopathy, kinesiology, from, massage, psychotherapy. The scope was in those days, because I didn't know Ayurveda then, right? I just felt, oh, without manual treatment, it's not complete. Without the psychological and spiritual dimension, it's not complete. Without nutrition, it's not complete. So we had all this, because in homeopathy, this is not there, right? In naturopathy, in which I was trained, it's there, but I just understood that the naturopathy, as it is practiced also here, is not a complete medical system based on a logical foundations that is like a mathematic scientific system through which you can just run through logic. It's here, especially in the West, it's just a piecing together of different techniques. And I just felt that wouldn't do to bring a global solution. So we were working with all those people. I tried to bring all of them together, like osteopathy is something we would find in Sushruta medicine, right? And it didn't work in those days. It's 30 years ago, right? People didn't understand why they should collaborate. Why should they? And I tried to make them work, understand the limits and the possibilities of each of the techniques so that the patient could get optimal coverage. And that's when I was despaired. I thought, we don't have that medical system. And that's when I met with Ayurveda. And Ayurveda just had everything in one system, one language, one logic, one scientific construct. And it was taught up to university level in India with the classical texts still preserved. And I felt, yes, that can be the medical system that can come and really help mankind. So that's how, when I then discovered Ayurveda, shortly after, I decided to dedicate my life to the global promotion of Ayurveda. So it was actually integrative medicine was there before I met with Ayurveda. And then I started to do integrative medicine with Ayurveda. That's 30 years back. So now in that journey, I saw the challenges, there were risks, and that's why the regulatory work was so important. Let us first just go and have a look why integrative medicine, actually. Why should we have collaborative medicine? Very fundamentally. It's because if we go to a patient-oriented concept where the patient is the center, not the science, not the doctor, right? When the patient is the center. And in Ayurveda, it's very much so, because we do not even treat the pathology or a diagnosis. We treat a patient. But in the West, people were not treating patients. We were treating diagnoses, which were elaborate by science and by the doctor. So, it's a very sensitive difference. So when it comes to a patient-oriented concept, one would say, okay, what does the patient need? What can we possibly mobilize as means and tools to help the patient? And then we can move out from one only system, right? Earlier, it was modern medicine is the absolute dogma. Sorry to tell that it was like this, paradigm and dogma. And whatever didn't fit in was not reasonable or did not exist or was fantasy, right? So when we come to patient-oriented medicine, we say, okay, that patient needs something and it exists outside the system. Then why should we not open up to another system and bring systems together? I think that was really the first way that had led to the center in integrative medicine 30 years back. And then at the basis of a collaborative or integrative medicine, of course, is the idea that there is no single medical system that can address optimally the full span of health issues. Otherwise, it's not needed. You have one system. As in ancient India, you had only Ayurveda. Ancient China had only traditional Chinese medicine, and it catered to everything. There was surgery, there was everything. And if you have, when you combine the full Sushruta medicine and internal medicine, you have everything. Only Sushruta medicine has not been developed in modern times as earlier, right? Okay, so now today we just see probably to really cater to all the issues and related to health, we need to have several systems coming together. And when we look here, modern medicine today, the very strong points is, of course, surgery, is, of course, very modern diagnostic tools, is intensive care, is emergency care, is certain medicines that are really powerful when it comes to reducing pain, or also antibiotics, cortisone, anesthetics. So this is powerful and this is useful. Now, on the other hand, we already saw that there are limitations. There are limitations even to the most powerful painkillers, even to antibiotics. And then we reach a limit where just nothing can be done for a patient. And yet, if we are in a patient-centered concept, we would have to go and search further, right? So the weak points of allopathy, of modern medicine, we know that, is that it doesn't treat root cause. It treats symptoms and has therefore many side effects. Not only therefore, it has side effects because it doesn't treat root cause, but it just blocks the symptoms, does not even allow the body to express the problem anymore, right? But in addition, the kind of medicine that is used is aggressive medicine, very invasive medicine. So it not only creates side effects, but not treating the root cause, it creates often other diseases, new diseases, as a combination of the invasive medicine and the symptomatic treatment. So these are limitations. And when it comes to intensive care, emergency care, surgery, this is not that much there, because we are in a situation where the secondary effect or whatever it could enhance as long-term other health issues is not a question. So in these cases, it is mostly anyway the only way to help. And so when we look at the pathological process, we are on the top. It's after the somatic manifestation. It is when we have the complication, right? The chronicity, or especially the complication. There, modern medicine is extraordinary, and it can also help, obviously, in fine-tuning diagnosis. Even here, I put some how shall I say, hesitation, because I believe that in the past, with the various ways of practicing diagnosis in Ayurveda, we could have layers of understanding a disease that went further than what we can do with modern technology today. But this has not been generally so developed. And in any case, having the picture and modern analysis often, most of the time, will help us get a clearer picture, because we have two different angles of analysis to understand where the patient stands. So that is really precious. And of course, when we come to Ayurveda, the strong points are, as we said, the fact that it does root cause treatment, but not only. It has also the possibility to make early diagnosis and thus early treatment. Actually, what we call in the process of pathological process, before the organic manifestation, we have 4 stages. During these 4 stages, modern medicine considers that there is no issue. They would put that in perhaps preventive medicine. Whereas from Ayurveda perspective, we can already say there is pathology, we have to treat it, right? And if we do that, it's an early treatment. And we all know that the earlier we take the treatment in that process, the better will be the result. So this is really, really essential. For, like 15 years back, I was working with this Indo-Swiss Ayurveda Foundation that was mentioned. We have created it together with Ambassador Swash Pawan Singh, who was the former Indian permanent representative to United Nations here in Geneva. And he had an interest for Ayurveda. And he told me in those days, that was 15 years back, he said when they would gather in United Nations or internationally with other countries, it was obvious for all the countries that no country can afford curative medicine because it's too expensive. And to wait until a population gets really sick, curative medicine in the terms of modern medicine means from the 5th stage of pathological process on, means you just have a weak nation, right? And it costs too much. People would not be on their work also. It slows down a whole nation's dynamics. And speaking from the point of sheer finance, curative medicine is extremely expensive. So 15 years back, there was a global consensus that we cannot go for curative medicine. And Ayurveda is here and offers us that other level of medicine, offers us a level of medicine that is before curative medicine, that has the potential to maintain healthy our nations. Do we just measure what that means? It's very, very important. So these are the strengths of Ayurveda. So also much less side effects because you do root cause treatment, and the medicines are not as aggressive and invasive, yet they are effective. And Ayurveda is also effective on curative medicine level, right? So the limitations of Ayurveda are due to several things. One is that it has not been developed in its whole span over the centuries. I very much hope so, will be more and more developed now through the younger generations who found that interest again in Ayurveda. Compared to 20 years back, India is today a new world, right, when it comes to Ayurveda. And that the full potential would be explored, and as well as Sushruta medicine that could be more explored. But there are weaknesses there. And of course, when it comes to surgery is absent, intensive care, emergency care has not the same capacities. So these are perhaps where these both systems can be usefully integrative and collaborative. Now, there's one very sensitive point which I really wish to mention is, Ayurveda, that's the challenges of integration. We want to integrate. We understand we have to integrate. Okay, we have to find a collaborative approach between the two systems. Now, there are challenges, and they are here really. We have to be aware of them to take the right route. Ayurveda has quantum logic-based approach. It has a macroscopic theory-based approach when it comes to aspects like anatomy, right? It has this approach too, but it has an additional dimension. It is the quantum logic approach where matter, energy, and consciousness coexist in the form of intertwined, dynamic interconnectedness and interdependence. This is what we learn when we learn about how dosha function, and even when it starts from the guna, dosha, even the rasa, and then of course the prana, agni, and manas. All this is part. I just tell you, when I did my medical studies, now it's a little bit better, right? It's better. But when I did my medical studies, spirit, mind, psychology was not considered. It was only the physical body. And if a young doctor like me would start talking about the mental aspect, then we were supposed to be a little bit strange, right? And not very reliable people. So that's where we come from, okay? So now the West has evolved a lot in that way. We have made progress, but we are nowhere in an understanding of that complete interconnectedness of the whole thing, which is really based on quantum logic. And if you look at modern medicine, this is still based on the approach of classical physics, of Newton mechanics, and therefore it's called also macroscopic theories. They are non-quantum based. They have two dimensions comparatively to Ayurveda, which has an additional dimension. And when it comes to the really, I mean, when you study anatomy and you look at this really classical approach that classical medicine has, which is just the deterministic classical physics approach. When you look at that, it's okay. You can figure out how a body is made, but when you want to understand how the body is working, it's functioning, and it's therefore dysfunctioning, possible dysfunctioning. And when you want to understand what happens somewhere, unless it is a break of a bone, but even then we know that has other consequences, right? So, but if you want to understand the functioning and the dysfunctioning of the body, if you don't have the quantum logic aspect, you just can't understand it. Because even today, scientists know that our reality, the reality of our universe and cosmos, is quantum logic, right? Quantum logic based. So if we do not have these specs to understand the human body, we just can't understand it. And Ayurveda has that dimension. Modern medicine does not have it. And that is very essential to understand. That means, comparatively, modern medicine would have like 2 dimensions, and Ayurveda would have a third dimension that makes it a volume, right? Not just a surface. Now, when it comes to challenges, when you talk about integration or collaboration, how can you put a 3-dimensional reality into a 2-dimensional one? It's not possible. You will lose the 3rd dimension. So you will lose the essence of the system that has 3 dimensions. And that is really the very sensitive point. Now, the point is also that why actually, if we have such a system like Ayurveda with 3 dimensions, with large quantum logic understanding of reality, and which is there for millennia, why would we need today an integrative approach with another system that has been developed only over the last 1 century and has 1 dimension less of understanding? Why? And we all know the reasons are historical, they are political, and they are financial, right? The globally prevailing medical system, means the system that is in power, is modern medicine with a large, elaborately developed ecosystem, ecosystem supported by government, science, technology, finance, economy. And it is a natural reflection of the historical era of materialism and rationalism that mankind has experienced over the last few centuries. So there is nothing abnormal, but it explains us how we ended up there, right? But somehow we seem to be at a turning point right now on that planet, okay? First, before coming to that, obviously, if we have a system that is in place, which is so strong, and we talk about integrating, making a collaboration or integrating two systems, the natural path would be that the system in power would integrate the other one, the weaker one. And then what will happen? The third dimension, the quantum logic dimension of Ayurveda would disappear. And so we have no gain at all. And that's why the word collaborative medicine is actually a very healthy and important evolution that is the next step after what we called integrative medicine. Because in the word integrative medicine, there are options. And the very first, obviously 30 years back, and that journey through which I went, the first natural step would have been that allopathy, which is in power, would simply absorb some interesting aspects of Ayurveda into its own system. But when you take the specs of 2 dimensions upon something that has 3 dimensions, again, you will just lose the essence of that system. That means not only would allopathy not gain anything from such a process, but in addition, that other system would be diluted and totally altered in its foundations. And here we have a responsibility. It's not easy to stand up against the systems in power, right? It's not easy to have faith in oneself and say, yes, but actually what we're doing is right and it has its value and we have to stand up for it and we have to be, I have been advocating with Ayush, with WHO, with everybody that we should develop research concepts that are adjusted to Ayurveda, because as long as you have only research methodology designed for a bidimensional system, how can it accommodate useful research for a three-dimensional system? So these are all points where each of us, and you're the young, even those who are teachers now, researchers now, and the students, each of us, it's a personal matter to have that awareness and to stand up and say, yes, we want collaborative medicine, but we will not dilute what we bring in. We will stand up for it and we will have that courage and value it, even if it's not always easy. But this is our responsibility. So it takes some courage. It takes also awareness. I mean, it's not easy to see, because when Ayurveda starts talking, the more Ayurveda gets recognized and will start talking with modern medicine, and the more one tries to find common grounds, because one wants to make it nice, okay? Want to find common grounds, that's good. But we always have to be aware what it means. If it means to dilute the system which we have to bring for humanity, I recall it's a responsibility, then we should be very careful when we find common ground. We should be steadfast. And India can be like this. Indians can be very stubborn. I have learned that. And this is a quality. Of course, we have to learn to manage all our attributes. But here to say, okay, we do it not for our personal sake and not for money. We do it because it's at the service even of the Lord, who gave such an extraordinary medical system, and we do it for mankind, for the truth. And your own family and your children and grandchildren will benefit from it. That's the scope. Okay. So now, just to finish, I can share just a PowerPoint, one page about possible models for integration. I just try to see how I can share that. Ici, sélectionner une fenêtre ou un écran. Voilà. Écran entier. It's not this one. I'm not used to work with Skype. I can't. Yes, but let's do that. I'll try that. Do I see it? Can you?
Yes, yes.
No, it's not there. What you see now is yourself, is it?
Yes, we are seeing our thing, our photo.
Yes, that's not what I want. I want actually. Where has this gone? And if I do this now, can you see something else? Can you see a PowerPoint?
No.
You
No.
still see yourself.
Yes, yes.
Okay. You can see it?
No, ma'am. No.
No. Okay.
Ma'am, you can share entire screen.
Yes, that's what I'm doing actually. I have shared that. It's the entire screen. So that's it. Authorize. And then I have tried to put, if I open that,
Yes, now.
can you see this?
Yes, now we can see. You have to make it full
Okay,
screen.
great. Yes. Okay. So you see, models of integrative medicine, once we have that very essential thought process in mind of what it implies and which are the challenges, then we can look about practical models of integrative medicine. Because integrative collaboration, which are the forms? You can have integrative collaboration within one clinical setting, one clinic that can be a center of integrative medicine where representatives from different medicines work. So perhaps the very important thing to say, after having exposed the challenges, what is the main really tool or the way we can address a risk of dilution? It is really that in the first phase of that collaborative medicine, the two systems, now we talk about modern medicine and Ayurveda as we look upon a global development, right? So these two systems so simply work hand in hand as independent, full-fledged medical systems and find a way to communicate and to talk to each other. So that is the first phase. And then later on, by doing this, each one practicing in its full span, its system, but working together in a dialogue, one will learn from each other. And then one can evolve slowly towards what Antonio has proposed us without diluting Ayurveda. You see? And what happens then, actually, it is not that in that common growth, Ayurveda will be reduced to a bidimensional vision, but allopathy will grow by integrating the quantum logic from Ayurveda. So that should be that is the process, right? And when we look at possible forms, it can be integrative collaboration within one clinical setting, where you have different representatives from different systems, but working in the same setting, and the patient will be addressed by this, taken care of by these different interventions. And you can, of course, have a hospital that would be, for example, mainly modern medicine, but has an opening to integrative approach and would say we have one department in which we would do Ayurveda. Some hospitals like this exist now in India, and there a collaboration starts. And then you can, of course, have simply a small clinic, with just few practitioners. In the West now, almost no medical doctor is working in his own clinic. They make group clinics, they call it. So, and you would have in that one clinic people from different medical systems working hand in hand. And then you have the possibility in one same consultation. This is what Antonio Morandi does. This is what I do, because we have been trained in both systems, right? So we can have a person who has the understanding of both, and we can work like this in an individual clinic, in a center of integrative medicine, or in a hospital. And of course, we can have, and that's what we also do in the West with other systems, we have separate clinics or separate hospitals, but we do collaborate. We have one clinic in allopathy, one clinic in Ayurveda or something else, and the patient would visit both clinics because one of the doctors, let's say the modern medicine doctor, would send the patient to an Ayurveda center or the other way around, but they talk to each other, they collaborate, and they care for the patient in this way. So this would be the forms of practice, to always keeping in mind the process that we just designed before that. So I think that's my speech, my contribution. So if there are questions, I just try to come back to the session and yes, stop. Can you see me again?
Yes, ma'am.
Thank you so much, ma'am.
If
If
You're
anyone,
welcome.
if anyone has any question, they can ask.
Namaste, I am Dr. Naveen Kodladi. I would like to know about one thing is that for integration, we have multiple systems in practice, accepted medical system. That is, there is a more. It is good to know that Ayurveda is considered as one of the accepted medical systems in Switzerland, and it puts the scope of integration. And I'm very curious to know how about the availability of medicines, one part, and availability of the medicines in herbal and herbomineral, especially the saushadis or a kind of basmas or sindura kalpanas. Is there
Availability in herbal and
herbomineral like basmas and all? How far it is?
plasma. Okay.
How far it is available and how far it is acceptable there? That medicine.
Yes. It's okay. So you see, exactly. Switzerland has made a full regulation to integrate Ayurveda as a medical system, but of course, it is not yet practiced like this in hospitals, in public settings, because we are at the beginning of a process. So people are trained, they would mainly practice in their own clinics. And we have to first train enough people, and they first have to have enough clinical experience. And as you very rightly say, we need the medicines, because without Aushadha, we just can't do it, right? So we have to understand that the visions we had were bold, the regulatory work we did is bold, up to WHO also, the really bold vision for Ayurveda worldwide, right? But in reality, we now have to go step after step. So now for the medicines, so Switzerland is the only country in the West, unfortunately so far, but at least we did it here, where Ayurveda medicines can be recognized as medicines, not as food supplements or as cosmetics. And that has been a law that was passed in, I think, 2016, because it was part of that full process of recognizing traditional medical systems in the health system in Switzerland. And one of the claims, that was a popular vote that made a change in the constitution. And one of the claims is we have to adjust the law on therapeutic products. And this was done in 2016. And thereafter, it took some time from our community first to, do the groundwork and propose what medicines should be listed to be recognized. And then it was the whole matter of political work to understand with the law, how can we bring it through? Because by then, Chinese medicine had 500 single plants and 500 formulations recognized in the Swiss system, right? And we had 0, right? So we had to find out how can we do that. And looking into the law and everything, we found out that if a plant has been used for 15 years at least in Switzerland without and being known, without having showed problems, and if it has been at least documented for 30 years in the original country, means India, it can be admitted on a positive list. And so what we actually found, we saw that Maharishi products had been sold over almost 20 years in Switzerland, and they had many ingredients, right? They had their own proprietary formulations, but the ingredients were there. So we, and these people were part of our, regulatory groups, and I really requested them to do that contribution and to just identify all these products, give evidence for it that they were there. And they did that. They did a wonderful work. And they went through the Swiss Medic, this is the Swiss FDA, and submitted these lists. So that we came up to with 240 single plants, right? And these 240 single plants, then they were, Swissmedic then went to the India Pharmacopoeia Commission, and they started, I think 2019-20, they started the discussions. And in 22, the first 40 plants were registered on the positive list. And unfortunately, out of these 40 plants, then only 8 were from the Pharmacopoeia, the Ayurvedic Pharmacopoeia of India. The others were from the Chinese and the European Pharmacopoeia, probably because Pharmacopoeia of India was not fully perhaps on the level. But now, the last 3-4 months, this has drastically changed. We have now 80 plants on that list, and it's announced that they want to go to 240 plants. We have now 80, and all the new 40 come from the Indian Pharmacopoeia. So this is a great progress. Yes, this is a congratulations to India, because it's a huge work, right? So now we have now 80 plants, and these 80 plants, whatever formulation is there that has these 80 plants is recognized as a medicine, as a therapeutic product in Switzerland, and can be sold as such, right? And if you have, let's say you have a formulation with 7 or 8 ingredients and one is not on that list, there are simplified procedures to yet get it recognized, but it's procedure. Now, what is the difficulty? Why is it yet not so easy to bring these medicines here is that as it has now shifted, it's no longer on the level of food supplements, but as therapeutic products. There are stringent requirements when it comes to documentation. You would see in a package of allopathic medicine, you have these leaflets. And in Switzerland, it needs to be in 4 languages, because Swiss national languages are French, German, and Italian. English can be added for the sake of, because it's international language. And you have to document everything about that, about this product. And this is huge work. And then the packaging has to be standardized with European standards. So the work that has now to be done from India's side is reach to European standards when it comes to packaging and documentation. And of course, always related to, with respect to this list, which should come more up. And Bhasma, perhaps Shankar Bhasma, I think perhaps we have put that up, but we were not able, the West, what had happened with the Saber articles way back in 2005, 6, 7, 8. I mean, this has been a disaster, and it's a political game, nothing else. So they knew Bhasma is so powerful. So they have just as a first step now blocked this. But that's not a problem, when Ayurveda will come more and more to be established and first come in with the other products. At a point in time, it will have enough say to say we bring the Bhasma in. We have just to go step by step. Okay.
If anyone has any other question, they can ask. Okay.
Ma'am, this Panchakarma procedures are allowed, no?
Yes, of course. The people here, as the way we have regulated, this under this new constitutional article, it was planned that we train fully fledged Ayurveda practitioners who are not allopaths, right? They will have a similar training to BAMS. They have all the fundamentals of allopathy that is needed for the collaboration, but then they have a full training in Ayurveda. And the competence, when you look at in the regulation, It's the same as a BAMS doctor in India. So they can do, actually, I do not fully agree with that because I think they should need a layer more of training to really practice Panchakarma, right? But again, we have to go one step after the other. They have fundamental good understanding, but they will themselves understand that they have to go more into training and get trained more in India. This is part of the process, but it's absolutely allowed. Yes. Even, I mean, Agni Karma is there, Rakta Mokshana, everything is there.
Thank you so much, ma'am. That was indeed a very insightful session. We are delighted by your gracious presence today. Now I request Dr. Pavan Kumar Gudatwar sir, chairperson for today's session, for his valuable remarks over this session.
Hello. Hi, Simon. It was
Hello.
good to reconnect. I hope you
Yes.
remember Jaipur days. So it was good. And I hope the youngsters were also able to walk through with you to the great scenario which you painted very nicely. I especially like that replacement of integrative with collaborative. That was a important insight from your side and from your so much experience. And then this is this wonderful work which you have been essentially fundamental to what licensing authorities in Swiss regulatory authorities have recognized Ayurveda as it is. As if you have recognized that, she used the word BMS also. So BMS from India is recognized as such in Switzerland, if I understand it correctly.
As actually the BMS is not recognized directly as such. You have to just go through a equivalence procedure. It goes through the Red Cross, and you have to learn the language. And you need to know about culture. You cannot treat someone when you don't know the culture, the mindset, the habits, the seasons, the food. This is very, very important. And this is why I've been always advocating that, again, stepwise we have to go. First, Indian doctors have to come to various places, but we have to train local people because this has to be adapted, right?
True that.
Hmm.
Any plans of collaborative schools like ISA, some work from Switzerland coming to India for further studies? Any partnerships?
I'm not sure if I understood you well. Can you repeat, please?
Any plans of starting some collaborative schooling of?
Yes, we have plans, but you see, our problem, we are facing a very difficult period, to be frank, over the last few years. Why? Because after having done all we have done, we wanted to start with these levels. I said right now people are just working in their separate clinics with rather limited means, right? And we felt, okay, if we have now to implement that whole thing, what we need is to utilize the ecosystem. And we first thought we could utilize allopathic ecosystem, hospitals, retirement homes, pharmacies, research centers. And we just saw it's not working. It's not possible. That means we have to create ourselves a complete ecosystem for India. You know what that means? I mean, it's so huge. That means a lot of investments. It needs people skilled in politics, in entrepreneurship, in science, with vision, with integrity. It needs a lot. We have to develop academy, develop clinical practice with centers, with IP centers, pharmacies, production centers, even cultivation. This is beyond my personal possibilities. So I would need because we are a small group of people, but we would need actually some miracle to happen, or someone really strong with means and vision to come and help set this up. Otherwise it will remain, at the level as it is now, and it cannot fully develop. Yeah.
I will get back to you, Simon, with this in some personal communications. Not proper place right now to discuss further this, but this is a very important idea. We should not let it go to waste.
You have to repeat it once more. What is a good idea?
What you said about the
Oh.
collaborations and we should take it further. And there are persons with wherewithal to take it further. So we should not let it go to waste at this stage.
Yes. Yes. I'm
So,
praying every day. Yeah?
yes, yes. Got that. But
We need some divine intervention.
Yes, but I hope you have written some mails to Secretary Ayush.
Yeah, I'm in touch with him, but you know what I feel is that mankind right now and the planet Earth are going through it is a huge chaos. It's a creative chaos, and we are at the turning point. And I'm just waiting a little bit more because I think a lot of things will manifest and are changing, and we have just to find, Kala, the time is so important, and let the right time come for things to happen.
Got that. But are you in touch with this group of friends of Ayurveda? Group of friends of Ayurveda?
Not really.
Based in Switzerland itself?
Not really. We did not have, you mean a group of friends?
Yes.
No, we were a group of political activists. It's not the same, So we have to evolve to other levels. And when you are in these fields, there's a lot of competition. So friends is not so easy.
Got that.
I think, but you're right. This is extremely important. I mean, we have to get there. So I try to find it with India, but we cannot only find, if I find it with India, it's fine, but it won't change anything for Switzerland. So there's a lot to do on such levels. Yes.
Let's hope something good comes out of it. Thank you. Thanks for this wonderful talk. You have taken us to beautiful scenario what you have painted, especially the quantum mechanics thing. Interesting idea. Not the macrophysics, but quantum. Very nice. Thank you very much.
Namaste. Thank you, Dr. Simone Hunziker. And you have accepted our invitation through phone and mail. And even though you are busy, you have accepted to come on online. And even though our session has gone late, you have given us time. So we are very thankful. And our young generation has got very good inspiration from you because uh, from Swiss, you are having such a what we call devotion to India and Ayurveda and toward the mankind, healthcare and all. So that is what one has to learn from you because you are like what our aptas or something I found in you. I am very thankful to you and my pranam to you. Thank you.
Thank you very much. It was a pleasure. Bye-bye.